Welcome everyone to today's event, Ask the Experts, Young Leaders Showcase Gender Perspectives in the HIV Response. I'm joined today with a fantastic panel. Kiho, could I kindly ask you to introduce yourself?
I was muted, sorry. Hi, my name is Kiho. I'm a postgraduate researcher working on HIV cure based in Australia.
Great, thank you. Marie, could you go next, please?
Hi, everyone. My name is Marie. I'm a psychologist and I work in the HIV and AIDS space. I work with Global Women's Health Rights and Empowerment Initiative. It's a sex worker and LBQ-led organization here in Nigeria, and we work at grassroots level. Thank you.
Great, thank you. Karen, can you go next, please?
Sure. Hi, everyone. My name is Karen Dunaway. I am the Global Programs Officer at ICW, and I am based in Argentina.
Thank you, Karen. Alicia?
Hi, everyone. My name is Alicia Krieger. I am a clinical pharmacist and epidemiologist. I am the head of the Advisory of Inclusion, Diversity, and Equity Health at the Ministry of Health of Brazil, and proudly, I am a trans woman.
Thank you, Alicia. Amy?
Hi there, I'm Amy Henderson. I'm the manager of the Capacity Development and Engagement team at the International AIDS Society, and I'm really looking forward to hearing from our speakers today.
Great. And my name is Daria Besting. I also work at the International AIDS Society, and I will be your moderator today. I hand it over to you, Kiho.
Well, thank you, and thanks for the introduction and having me today. So my name is Kiho. I am a graduate researcher working on HIV cure. I'm specifically in my third year of PhD. And so I was born in Japan. My parents are Japanese, but I was raised in Australia. So I did my schooling, university here. And then I went to Japan for my master's degree. I worked there for a little bit. And then I came back to do my PhD. So as for, from the research perspective, I really like my work because the numbers you crunch out, the data you get, they are very much objective. They're true to everyone. It doesn't matter who you are, where you're from, what you are. I think that's what I like about science, and obviously in an ideal situation it should be merit-based as well, how you get reviewed in your performance. And also I get to do my work, and perhaps that could slightly contribute to make changes in the world. So in my case, hopefully a cure or understanding better about HIV. Yeah. So I think what's very much relevant to the topic of today's conversation is the fact that when we do things like clinical trials or test new compounds, we could have a bit of a skewed population that we sample from, and that's purely because sometimes the demographic, so the people who are affected by HIV in a certain, let's say in Australia, could be a little bit skewed, so in terms of the gender, the age, and the ethnicity. And so what that means is that what we're getting, the data, isn't representative of the wider, more diverse community of people who are affected by HIV. So the way to overcome this is obviously by collaborating with people across the world, and also perhaps having people who are well established in the community, who feel more comfortable that people can talk to inform them about things like clinical trials, so that science can actually positively and more meaningfully contribute to the needs and the demands of people who are living with HIV. So that's the research perspective, and more from the career perspective is, I guess, when I worked in Japan, I did experience a bit of sort of comments made by people based on your gender or gender specific sort of behavior that you're expected to adhere to. Whereas in Australia, I feel like that is not so much the case. It could also be that because I'm in a very privileged place where my bosses are very supportive. So I've got two bosses. One, Sharon Lewin, she's a very successful scientist, but also she's got a family. So it's nice to have a role model. My other boss is also, he's got 4 kids, he's a brilliant scientist, so it's nice to see people who are succeeding in their profession, but also they've got a family and they are really spending time with their kids and trying to make everything work. So that brings me to the discussion that is very close to sort of me. It's a very timely and it's very it impacts me as well. So I've got a partner and we've been talking about what we should do in the next couple of years. Do we want to start a family? Do we want to buy a house? Do we want to buy a car? And all these things do come into the picture because everything overlaps in terms of the timeline. When you want to specialize, when you want to really advance your career and become more established in the field, but that might also be when you want to start a family. So that's where myself and the partner have been talking what we should do, what kind of choices we should make, what kind of priorities we should be aware of then, so that we can make decisions based on those priorities. So I guess one last thing that I could probably point out that is very also personal, but it's probably going to affect a lot of people and has been affecting a lot of people, is the fact that if you want to start a family, then all these other things like when can you get your maternity leave and when can you go back to work, if you're not that established in your field, is that even possible? Is that something you can negotiate, or do you have to work a lot beforehand to have yourself established so you can go back to work more easily? And that is a sort of a dilemma that people try to figure out. And also, what about the motherhood? So if you want to raise children, how are you going to manage to stay at home and be there for them? Because that's also a wonderful experience, but also with that at the expense of sacrificing your career. So it's really a timely and relevant topic for me as well. And so thanks for the opportunity to say.
Thank you so much, Kiho. And I think you brought forward some really important points that just showcase that we are full humans with a professional life, a personal life, with all these different things going on. So thank you so much for also sharing that with us. And with that, I'm handing over to Marie. Please take it away.
All right, thank you so much, everyone. Thank you for the opportunity to share my journey and insights, most especially in this field, HIV and AIDS. I'm really a passionate advocate. I'm an activist dedicated to addressing the different challenges that surrounds HIV prevention, treatment, support. Aside that, I'm really focused on advocacy, awareness campaigns, sexual reproductive health initiative, particularly for sex workers, adolescent girls and young persons and minority, that's the LBQ community. Next slide. Also, so one thing that motivates me or one thing that inspires me a lot is around the transformative power of education, prevention, and community empowerment. How well is the community informed? How well do they understand all the prevention treatments? Do they even know that there's support services for them? And then how can we also link sexual and reproductive health into HIV programming? And in all honesty, witnessing the positive impact of this targeted intervention, sexual and reproductive health, brought together into HIV programming is one thing that motivates me, that keeps my passion going, that keeps my drive going in this space. So over to some of the challenges. Next slide. So over to some of the challenges or the barriers in HIV response, especially at grassroots level. Talking about limited power for safer sex practices, adolescents and young girls, especially sex workers, due to the lack of enough condom in the community, or even financial challenges. Negotiating safer sex is a problem. Once a customer, a client comes and say that I have 100,000, that's in naira. I have 100,000 naira to give you. You realize that adolescent girls and young persons, you realize that sex workers are saying no, I can't. They can't even negotiate. They don't have the power of negotiation because of that lack of information, or lack of realizing that they have a lot of support services out there. Then barriers to access healthcare services. Adolescent girls and young persons, most especially, can't walk into a facility. There's this societal stigma and discrimination from the cultural context. What's a young girl like you doing in this facility? You can't have these services. So at that point in time, they just go into hiding, or just take the conversation with their friends who says, okay, I have probably the local herbs that can help you get better. Also, I've spoken about that stigma and discrimination for key population, especially walking into a setting and you want to receive a service and you know that, oh, this person is a sex worker, or this person is a trans person, or this person is an LBQ person. There's this look that healthcare workers bring forward, and like, what are you doing here? And so why? Or you have been abused, violated as a result of uh, uh, maybe a customer hitting you physically, and you walk into a police station, you want to seek legal support, or you want to report your case to the police. The next as a sex worker, why would you come and report? That's what you want. Stuff like that. Then social exclusion and increased risks of violence. They keep violating. Nobody wants to realize or even know that, oh, this person is a human being, this person is a woman. All they want to say is that, oh, you're a sex worker, so why are you complaining? You shouldn't be. You should be happy that someone can even approach you or even speak to you. So next slide. So those are like some of the challenges that continue to increase issues around, like some of the significant challenges that continue to hamper or intersect between gender and HIV response. And if gender is left aside just for the implementation of HIV response, we'll continue to have issues, and the global goal of ending HIV and AIDS in 2010 will be left behind. So we really need to see how we can continue to work in mainstreaming gender into HIV programming. But I would say that, next slide. Yeah, so I would say that bringing positive change, some of the most creative solutions that as a team, both for myself as an individual, the passionate activist that I am, and the group of young persons that I work with, some things that we have used to build the blocks for our success for us to be able to mainstream gender into the work that we do, HIV spaces. Staying curious, like what's happening, what's the global trend, what's happening in other countries, how do we even interact with other countries to say, okay, what's happening? Do we see how we can take a buy-in, bring it into our country? Then at the grassroots level, what's happening? What's happening at the national level? How then do we get involved? How then do we stay on the tables? Because decisions are usually made at the national, but we're at the grassroots level. So if we're not curious to want to know what's happening at the national level, we'll be left behind, and whatever they bring to the grassroots level is what they are now imposing for us to work. Then building diverse network, just like I was saying, we build a lot of diverse network, both in country and outside the country, both at the national, sub-national, and local level. So it gives us room to belong to various networks that do different things. Just by the time we put everything together, we are all achieving the same goal by ending AIDS in 2030. Also, amplifying marginalized voices. So I would say that it is evident, because there are feminist spaces that adolescent girls and young persons, sex workers, trans persons, queer persons, and now before, feminist spaces don't welcome marginalized voices. Feminist spaces does not recognize sex worker community. They don't want to even have anything to do with transgender person. But I'm a beneficiary currently at the moment in feminist spaces. And then the young feminist forums are also beginning to understand diverse and intersecting voices and accepting us on the table. So we have also developed resilience to say that we're not giving up until we all see the end to HIV and AIDS in 2030. And we're saying that, yes, we want to be there. We want to be on that table. We have also prioritized self-care. Self-care was one thing that even funders who give us funding do not even prioritize. But I'll tell you that at the moment, for the first time in the past 8 years in my journey, my organization had to work with a funder who we wrote to them to talk about the importance of self-care. And they honor that retreat. In fact, I realized that when we are refreshed as frontliners, you are able to even provide better services to beneficiaries, to survivors, to survivors. Yeah. So, but if you're not well equipped, if you are not refreshed, if you're not ready, you keep taking in a lot of issues. You keep answering 2 a.m., 3 a.m. You are at the front line. You are at addressing issues of incidents of violence, and somehow your health begins to deteriorate without you realizing. Well, we have agreed to prioritize self-care. We have embraced innovations. Is this working? Is this not working? How then do we work on this? How then do we cope with this? That's the issue of transformative gender programming that we did. How do we seek for funding or sexual and reproductive health that can help us navigate and then get to address the issue of HIV and AIDS as the broader goal? Also, we have led with passion and compassion. The space that we work in has a lot of young persons who are passionate, who understand, who are, aside just being community members, you understand that the work that we do is driven by passion and compassion. We have embraced empathy beyond sympathy. We have embraced empathy. We have put on the shoes of those who are even more victims. We are realizing that, okay, as a sex worker organization, we initially started as a sex worker organization. Along the line, we realized that we have queer sex workers, we have trans sex workers, they are in the LGBTQI community. We have sex workers who are drug users. Do we exclude them simply because we just want to implement it for sex workers or we want to work with sex workers? No, we understood what it means to lead with passion, compassion, and say that no, for all these persons that we are going to be working with and working for, we all need to be both at the decision. So even our board members comprises of sex workers in their diversity. Thank you very much.
Thank you so much, Marie, and thank you for bringing all these important points forward and sharing this advice with our audience today. And now I'm going to hand it over to Karen.
Hi, everyone. Good morning on this side. First of all, thanks to the IIS for the invitation, and excuse me if there's a lot of background noise or if I drop suddenly. This sky is falling outside with a thunderstorm, and hopefully I will stay on the entire session. And hi, everyone. To start off to talk about what brought me here, in a nutshell, are my parents. I was born with HIV and I started activism and publicly disclosing my HIV diagnosis or HIV status since I was just a kid. I was 8 years old, and this started within the organizations founded by my parents. And I can say there are pioneers in the HIV response all the way, and they started all the way back to 1999 when I was just a baby. And since then, I've been an activist, starting advocating for children living with HIV to have a childhood free of stigma and discrimination in Honduras. And I am currently the Global Programs Officer at ICW. ICW is the International Community of Women Living with HIV. And here are some of the pictures of the work that we have done so far. We co-author a paper of the importance of community-led response with the 3 sister global networks of people living with HIV, GMP+, Y+, and ICW. And below is the first meeting of the Future of AIDS movement supported by UNAIDS. And we will launch this initiative and the multirenal consultations findings at the AIDS conference in July, FYI. Next, please. When we think about intersectional stigma and or the intersections of gender and HIV, I've been actively engaged in the global feminist HIV response for the past 3 years, and the intersection of gender and HIV response is multifaceted. We won't have the time to touch base on every intersectional challenges the women living with HIV face. And by that, I mean face not only because of their HIV status, but on top of that, just for being women, for being young people, for being sex worker, for being transgender, for their sexual and gender identity, for their socioeconomic status. And in ICW, we have a leading role at the international partnership. We are a partner on the Stigma Index 2.0, the People Living with HIV Stigma Index 2.0, in which we do a training, which we called the JESI training, Gender Equity in the Stigma Index. And we support women's engagement at all levels of research, and we seek to ensure that the study offers data and policy recommendations that address gendered experiences of stigma and discrimination. And when we talk about intersectionality in this training, we use this visual aid depicting intersectionality as a wheel. And in this visual, the innermost circle represents person's unique circumstances, you know, your life context, where you live, what do you do for work. And then the second circle represents aspects of your identity. That is your religion, your age, your income. And in the third circle that surrounds everything represents different types of discrimination and attitudes that impact the identity, like racism, discrimination, classism. And then it is covered in the outermost circle, it is covered, all the other circles represent a larger forces of structures that work together to reinforce exclusion, like politics, legal system, immigration system. And this makes you think and understand about how different identities create layered stigma and what this could mean for how we think about responding to different kinds of stigma and ensuring we eliminate the stigma for all people living with HIV, including people living with HIV in key populations. Or, in other words, quoting the great Audre Lorde, there is no such thing as a single issue struggle because we do not live single issues life. And the last one, please. Thank you. And we have developed accessible resources for women living with HIV, including an interactive toolkit and a workshop focusing on feminist leadership and implementing the PLHIB Stigma Index. The Stigma Index is a research tool by and for people living with HIV to create data and to evidence-based advocacy. And in the workshop, we explore research process, intersectional gender analysis, and gender equitable approaches. We also have a innovative and collaboratively developed the ICW Feminist School that sometimes has been led by the Young Women's chapter of ICW. And here we support women living with HIV in deepening their feminist analysis, building their advocacy skills, and even implementing their own feminist projects. And we also have a young advocates program, like ICW's social media team, when we do social media advocacy. And I think that's it. So thank you.
Thank you so much, Karen, and special thanks to you for joining us despite a thunderstorm happening. We're very pleased to have you here. And that, I come to our last speaker. Alicia, please take it away.
Thanks again, Daria, and thanks. I would like to thank IAS again for inviting me for such an important panel with so important and wonderful different women. I don't know if I am young yet, as I said, because I am 30 years old. I just turned 30 years old. So according to WHO definition, a young person is someone up to 29 years old, but I consider myself young. Thank you so much. I am not just one woman. I am the sum of several women who built me. And here are three of them. The first one is my great-grandmother, Celia, who was my first teacher. She taught me how to read and write my own name long before I started school. She taught me the importance of studying. The second is my mother, Nadine, who always loved me and taught me the importance of loving. By the way, this is our last photo just before the beginning of my transition at 16, when I was 16 years old, and just before she passed away, unfortunately. The third is my godmother, Janea, who has always sent me traveling all over Brazil since I was a child. She taught me the importance of being free to the world. The first one taught me the importance of studying, the second one, the importance of loving, and the third one, the importance of being free to the world. Unfortunately, they already passed away, but they are always with me and I am here for them. Today, I'm a woman who knows the importance of studying, loving, and of being free to the world. So I am because we were, and we are, and we will always be. Next one, please. I think what I just said on the last slide explains my journey. Unfortunately, because I don't say this in a ton of pride, actually almost in a ton of denunciation. I was the first trans woman, actually the first trans person to receive a bachelor degree from the State University of Ponta Grossa, one of the largest university in my state and all entire south of Brazil. And it's more 50 years of history. That was in 2015 when I was just 21 years old. And then I became the first licensed and registered trans woman to be a pharmacist in Brazil. That same year, I traveled to Salvador in Northeast Brazil to present my scientific research on drug-drug interaction between ARVs and hormones used by trans women, representing my college at a Latin American conference on youth and HIV. And to my surprise at this conference, there were two people from the Ministry of Health of Brazil who attended the presentation of young trans women who was a pharmacist showing robust science and being part of a key population as well. And they told me, you could work at the Ministry of Health. And I said, oh my God. So I did a selection process after this invitation, and then I started working at the Ministry of Health in June 2015, and I spent 6 years working there, leading the agenda of HIV among young people and also among trans people. And for family reasons and the political instability that Brazil has experienced in the recent years, as you know, I decided to end my career, my journey at the Ministry of Health and return to my city in south of Brazil, where I stayed for 2 years working with epidemiological surveillance and as a clinical pharmacist in an HIV service in Curitiba, the largest city in southern Brazil. In 2022, with the new government elect in Brazil, I once again received an invitation from Secretary Dr. Etel Maciel to return to the MOH. But now being the head of a new advisory created by Dr. Etel, the Advisory of Inclusion, Diversity, and Equity in Health at the Health and Environment Surveillance Secretariat in the Ministry of Health of Brazil. Next one, please. And I think the main reason, or one of the greatest reasons that led me back to the MOH is here. In comparison to general population Brazil, and even with other key populations, trans women and travestis, as we say in Brazil, just like me, are those who have the highest HIV prevalence in our country. This is due to social and structural reasons, in a country where transphobia is considered a federal crime thanks to a Supreme Court decision, but which continues to be since 2016 the country that kills the most trans people worldwide. So nothing better than ourselves to lead the agenda that talks about our lives, nothing about us without us. Together with a very qualified team from the Department of HIV and AIDS, tuberculosis, viral hepatitis, and other SCIs of our MOH, we fight every day to change the situation. But it's not easy. I don't work alone. We work as a team. Next one, please. To sum up, here are two great achievements, in my opinion, from the first year of our work at the Ministry of Health in this new government. The first one was the translation of ICD, the International Classification of Diseases, 11 into Portuguese, carried out for the first time ever by Brazil, because it was previously done by Portugal. In this new version of ICD, trans identities, as you may know, are no longer considered mental disorders and are now considered just conditions related to sexual health. And along with the term gender incongruence, widely used around the world, here in Brazil, we have added the term gender dissident. Why? Because we are not incongruent. This term was required by trans civil society here in Brazil because, as I said, we are not incongruent. We just distance ourselves from the gender standards that were imposed on us at birth, and that is being a dissident. The second one, as I am a pharmacist, as I already said, is very important achievement in my opinion. It was the work that resulted in the authorization of the prescription of PrEP and PEP by pharmacists, together with physicians and nurses. Brazil has become the only country worldwide with more than 200 million inhabitants and with a huge public health system to authorize pharmacists to prescribe PrEP and PEP throughout the country, and not just in some states or cities as in other countries worldwide. Here in Brazil, pharmacists are allowed to prescribe PrEP and PEP all over the country with no special conditions. This is what, as I could say, this was a joint effort between the MOH and the Federal Council of Pharmacy in Brazil. And Brazil was highlighted at the World Congress of PIP, that is the International Pharmacists Federation in Spain in 2023. So I can work, I'm able to work at the Ministry of Health with the trans agenda and with the pharmacy agenda. I think this is a very committed work for the entire Brazilian population, because this is the success of a team. It's not only about me. Next one, please. And for that reason, I want to finish by sharing this phrase from a very famous Brazilian singer who was one of the icons of the fight against the dictatorship in Brazil in the 80s. Raul Seixas, and he said, "A dream that is dreamed alone is just a dream, but the dream that is dreamed together is reality." Once again, I am because we are. Thank you so much.
Thank you so much, Alicia. This was really inspiring, and I would like to thank our whole panel for these presentations. I think we've all learned a lot already, and now we can start with the Q&A. I'm going to kick us off with a question that is, what kind of advice would you give people starting out in this field? I know, Marie, you already shared some advice, but maybe, Kiho, maybe we can start with you. Do you have anything additional to share?
I suppose anyone trying to be in science, having that sort of role model that you can look up to and you respect, and you can learn a lot, that definitely helps. Also, talking to everyone, your peers, and also opportunities like this where you get to meet lots of inspiring people. That's definitely something, but it's not just for science, but anything being really good at what you do. I think that's just first off really important than anything else.
Great, thank you. Karen, do you have anything to add?
Yes. Especially for people who are just starting their activism journey. As young women or young people in general, you will face organized opposition to your concerns, ideas, your dreams, your actions. And my advice is to do it anyway. Speak up, be brave, and remind yourself that you have a unique perspective, you have expertise, you have experiences as a young person, and you know what is needed. Your voice is valuable and is important. Try also not to get caught up in politics that divide young people, that divides a lot of communities. You know, there's a lot of competition for resources, there's a lot of competition between networks and organizations. But focus rather on work closely with your peers and support each other. And my last advice, it's a very practical one that has helped me a lot, is find yourself a good mentor. Peer mentors and mentors who have been in the response for decades uh, are really helpful to boost not only your path in activism, but also your political instances as well, and treat every experience as an opportunity to learn something. These mentorship helped me a lot, especially when I did the Youth Champion program, that I think it's called the Youth Hopsy Seed Grant right now. When I needed a mentor, and I saw the importance to rely on our peers and to seek advices. And this is also how I deepened myself into the global feminist HIV response, and the importance of advocate for evidence-based advocacy. And that was my 3 suggestions, advice.
Thank you so much. We hear the diverse networks and the mentorship as a piece that has come up quite frequently. Alicia, do you have anything to add to that?
Yeah, I would say, like in the tale of Cinderella, have courage and be kind. Why? We know that we need to have courage to face all the prejudices that surround the HIV field itself, and working with key population, even more so if you are one of them. Kindness is necessary to know that you cannot do anything alone. As I said, we work as a team. I think loving what you do is also essential, which doesn't mean you don't have to be well paid for that, but you need to love what you do. We need to provide opportunities for more people from key populations to be on table, to be in the Ministry of Health in different positions with decision-making process. I think we need to do that. We need these persons on table, but we need to provide conditions for that people to work properly. In Brazil, we have a brilliant framework. We have 2 representative trans women in our federal Congress. I think is one of the great lessons learned we have here in Brazil.
Thank you so much. Then I will follow up on that for our panel. We have a question from Nitya George. Any advice for mentors or older colleagues and how they can facilitate your journey and make sure you're part of the important conversations or dialogues? Anyone from the panel, feel free to unmute yourself and jump in.
Just on top of my head, some of the things that I've seen in the past 10 years, 18 years since I started the activism journey. It's for the mentors and older colleagues. It's to leave your adult centrism aside. Just because we are young people does not mean that we not know things that we don't have innovative ideas and we cannot lead. We can and we will. And when we go to the decision-making tables, we need to be a peer. We are not behind. We are just on your side, hand in hand.
Jump in with the next question, which is for Keyhole. Could you explain a bit more what your PhD is in?
Okay, sure. So my PhD is very cell science heavy. So I work with the viruses itself. So and I also look at the mechanism how HIV becomes latent, so how we can't get rid of it, and we also look at new compounds that could potentially lead to curing HIV. And I also look at how our immune system, so the T cells, can function better to control and eradicate the HIV infected cells. So to do any of that would really heavily depend on the kind donation from like the blood and the cells donated from people living with HIV. Without any of that, basically our work gets a little bit, not just a little bit, significantly stagnant. And yeah.
Thank you so much. That is very important work and very interesting. What advice could you give to a young girl living with HIV in Africa? Maybe Marie, do you want to take this one?
Yes, thank you so much for the question. So one of my greatest advice for a young girl living with HIV in Africa is, first of all, to be able to embrace yourself. When you embrace yourself, you can, whatever the world is bringing towards you, you're going to hit it hard. So embrace yourself, realize that that is not the end of the road. That's not what ends you. That's not what even defines you. So you have to, first of all, do what we call self-worth, self-love analysis, and then build a lot of peer-led support networks. Engage with peer-led support networks. It could be virtual, it could be physical, it could be hybrid, depending on what works for you, depending on your location in Africa. Just realize that peer-led support groups will help, whether you're going to be doing across countries, or you're going to be doing within Africa, or you're going to be doing within the country or within the states that you live. Peer-led support groups are like super, super, super good. And then you should be able to develop resilience. Develop resilience in the sense that when you get into a space, when you get into a forum, they might be making some critical, they might be making some examples that might not sit well with you, but your resilience does not take you out of the meeting, but put a stop to whatever they are saying that doesn't sit well with you. Nurture your mental health. Seek support when needed. Understand that setbacks are part of journey. It's not the end of the road, it's part of the journey. When you embrace it and you develop resilience, you're going to nurture whatever it is. And then look at how you can continue as a young person, advocate for comprehensive sexuality education, whereby we can reduce stigma, societal stigma, peer stigma, self-stigma, see how you can be a champion, see how you can promote comprehensive sexuality education to also empower young persons to make informed decisions about their sexual health, to also make them realize that stigma ends with both of us. Stigma ends with you, stigma ends with me, discrimination ends with you, discrimination ends with me. And will I say that probably, yeah, that's all that I have for now. Thank you.
Thank you so much, Marie. And another question that I find really interesting that is open to the whole panel to get your perspectives on is how do you go about advocacy in a country with laws against what you're advocating about? So any perspectives, any suggestions from our panel?
Can I think Brazil is a great example. Laws are not sufficient, are not enough, because in Brazil, transphobia, as I said, LGBT phobia is considered a federal crime, thanks to a Supreme Court decision. And it's not enough because people is still murdering. Brazil is the first country worldwide to kill trans women. We need to work with the societal competences, the cultural competences, with a cultural and educational revolution. Laws are not enough. Yes, we need to fight for different laws. Our Congress here in Brazil, our federal Congress, is very conservative. So all of the legal framework we have in Brazil, they are from the different laws are from the Supreme Court. So I don't think laws are enough. As I said, we need to struggle and we need to fight for a cultural revolution worldwide.
Thank you, Alicia. Does anyone have anything to add to that?
Yes, I do. So I would say that one other way, just to add to what my colleague have said, thank you very much, Alicia. So another thing is awareness and education. How aware are you about the law? You need to pick up the law. You need to pick up that document. You need to read it word by word. You need to be able to interpret. If you don't know how to interpret the law, get legal hands that knows how to interpret the law to be able to reinterpret that laws for you. So it's like saying that first raise awareness about the issues that the community, for example, here in Nigeria, LGBTQI is an issue. There's a law that criminalizes that, the Same-Sex Prohibition Act in Nigeria. First of all, what we do is even understand that LGBTQI there's an issue in the community. What can be done through public campaigns, through workshops? We need to first of all equip the LGBTI community, equip sex workers to understand the law. And now there's a part of the law that says that it is except you are caught in the act. Meanwhile, the world, due to social stigma, societal stigma, peer pressures, and the rest, everybody feels like once you are dressed in a certain way that does not conform to culture, they already tag you an LGBTQI person. You are arrested, you are brutalized, you're violated. But now the law says once you're caught in the act, how then do you catch someone in the act when they are in their private space? The Constitution, which is supersedes that law, says that there's freedom of words, movement, there's freedom of engagement, there's freedom of privacy. So how do you catch someone in the act who is in the private space? So also another point is coalition building. How well do you engage with like-minded organizations, activists, allies? It could be within the country, it could be across country. Build coalitions. Engage with activists, engage with allies to amplify your advocacy efforts. Also, strategic litigation. It brings me back to my first point that talks about awareness and education, being informed about the law, then understanding that there's going to be strategic litigation. It is a powerful tool to challenge discriminatory laws. Do you have legal professionals, whether for pro bonos that needs to be paid? How do you guys do strategic litigation? Do you go to court when we have cases of LGBTQI in court and challenge the entire laws? No. We have to take in the sections, the chapter that we need to challenge. Then how do we engage with lawmakers? We bring them to the table. And bringing them to the table, you don't bring in the issue to their front. You need to come through what we call strategic engagement. You need to see how different issues intersect and then affect every one person. First of all, understanding that we are all humans. Our identity, our orientation is not what defines us. It's not what is our identity. The mere fact that we are human beings and we exist, bring it to the table from that context, bring it on the table from the context of health. And then you can begin to challenge every other issues and you begin to engage with lawmakers on different laws that has been established by the government. Then engaging with civil society organizations. How well do you engage with human rights groups, health organizations, community-based organizations? I have a popular saying that I usually tell people that if you go one, you will go faster. But if you go together, you will go further. Meaning that these issues are issues that advocacy is not a one-day job. So meaning that if you want to go at once, yes, you will be able to meet numerous numbers of stakeholders. But at the end of the day, how far have you gone with your engagement? So when you go one, you go fastest, but when you go together, you go farther. Thank you very much.
Thank you so much, Marie. And now I would like to bring in a point from Larissa. She's living with HIV in Cameroon, and it's really difficult to get in touch with communities who are also living with HIV. And I was curious if the panel had any advice for this situation.
So, one quick advice is that I don't know so much about Cameroon, but I think I have organization here in Nigeria that is having to work around that context. And then I can liaise with other organizations in Nigeria as well to see if that's okay. Have you heard about Cameroon? Do you know organizations that exist that provide services for people living with HIV and AIDS? And if she can also approach the healthcare where she receives her medication, are they government-owned parastatals that are practically pushing that change, or are there international organization or funding who comes to support with those drug aids, or are they international organizations who have created community-based organizations? So she can find out some of those information from that facility where she receives her drugs. She can have a way to interact with the healthcare worker if they are very friendly set of people, to say that, okay, these drugs that we receive, can they even share insights on how do they get the drugs? If the partner is saying that, okay, we get it from international organization, oh, we would like to, or I would like to know more about this international organization, she can reach out to checking them on Google and see how she can start to engage with them. If they have community-based organization, who she can reach out to within Cameroon, that also is like a grassroots sustainability plan for that international partner. Thank you. That's my candid advice.
Thank you so much, Marie. Karen, do you maybe have anything to add to that?
I am also not sure. My video, sorry. I am also not sure about Cameroon. We do have about 120 national networks adhere to ICW. And maybe perhaps there's an ICW chapter in Cameroon. You can totally reach out to me and maybe I can help you out. But also there, just ask if you are part of a network already. Maybe you can ask if there's a woman-led network or a national network working. And I am sure that Cameroon context is complex, and there might not be, but also you can start your activism with or without a network as well.
Thank you. And if I may plug the Youth Hub here as well, you can sign up to the Youth Hub and connect with plenty of people all over the world. Not sure if there might be people from Cameroon there as well, but it might be worth a shot. And with that, I see we have some more questions, but we're 1 minute to 12, so I need to close this meeting now. I would like to thank our panelists. It has been so insightful, and I would like to thank you for your time and all these important points you brought up. And I would like to thank the audience as well. Thank you for all these really important and interesting questions. And yes, thank you so much, everyone. And with that, thank you so much, everyone, and have a lovely rest of your day.